Head and neck cancers are located anywhere from the upper part of the throat down to essentially just above the collarbone. Head and neck cancers typically present with either pain or difficulty with swallowing or changes in somebody's voice. These cancers are very, very sensitive to radiation and chemotherapy. The patients tend to do very, very well. We have excellent outcomes with the more modern technologies of the radiation.
By the time we see the patient, they've already had a tissue diagnosis of the cancer that's usually either been done by a head and neck surgeon or an oral surgeon.
Our first consultation is probably the most important visit because that's when I first meet the patient, establish a level of trust with the patient and the patient's family members, and explain to them what is going to happen during their course of radiation.
After that appointment, we usually schedule them for further studies. Those studies can include CAT scans, PET scans, MRIs, ultrasounds, and we get other diagnostic material that we need in order to develop a really good treatment plan for them.
We then put together a plan for the patient and present to the patient based on their particular medical issues, based upon their particular cancer and type of cancer. We customize the treatment to them specifically.
Radiation therapy for head and neck cancers can involve either 3D conformal radiation therapy, intensity modulated radiation therapy, stereotactic body radiation therapy, electron beam radiation therapy, or even intraoperative radiation therapy.
For the early stage head and neck cancers, typically the treatments can involve radiation alone, usually about a 6 to 8 week course of radiation. The more advanced stages usually require a combination of chemotherapy and radiation therapy, usually for about the same duration.
The treatments have become shorter, they've gotten more convenient for the patients, and with the advancements in technology, I think that the side effects have actually decreased fairly substantially.
The type of reactions patients get from the radiation portion of this is skin reaction, redness to the skin, sore throat, difficulty swallowing, decreased taste, dryness of the mouth, and some voice changes. Now, because of the newer high-tech modalities we have for radiation, we're able to minimize a lot of those side effects quite a bit better than we did years ago. And that makes a big difference for patients for eating, talking, and just carrying on routine day-to-day activities.
We may enlist the help of dietitians or nutritionists to help patient maintain their weight, their caloric intake. We may also need the assistance of our speech and swallowing pathologist. So there's a whole team of people that get involved with us when we treat patients with head and neck cancers.
The outcomes we have for head and neck cancer are significantly better than they used to be. Our ability to detect cancers at an earlier stage has also significantly improved. So we've made quite a bit of inroads in terms of curing cancer and curing the cancer with less side effects than we did in the past.
We provide cutting-edge, top-notch, evidence-based technology with excellent interpersonal skills and really try to make the patients feel at home through this difficult period of their life.